Hello, my name's Mindy, and I'm one of the physical therapists with Duncan Home Care, and I just want to take a few moments to discuss with you your plans after surgery. When you saw your orthopedic physician, you were likely asked if you're planning to go to outpatient therapy or have home care come to you. Where you go for outpatient and who you use for home care is your decision, but we do have several unique features to Duncan Home Care, and I'll be discussing those with you in a few moments. For those of you that have someone that can provide regular transportation 2 to 3 times a week, outpatient is a great option. But for those of you that don't have someone that can provide transportation, if you have several steps to get in and out of your home, or if you think you might need just a few more weeks of recovery, then home care is a great option. And for those of you that want to be on home health services for a short period of time, then we can assist with your transition to the outpatient clinic. For the rest of you, you'll be on services anywhere from 6 to 8 weeks after surgery. If you're having a knee replacement, we'll come out to see you 3 times a week initially, and then start to decrease down over time. For those of you with a hip replacement, we'll come to see you anywhere from 2 to 3 times a week, and that will decrease down over time as well. You'll be seen by therapy any time frame between Monday and Friday, 8 to 5. And if you notify us ahead of time, we can likely get to you and do that admission visit the day after you come home from the hospital. And like I was telling you before, there are a few unique features to Duncan Home Care. And one of those is we have trained all of our therapists, myself included, in being able to perform that initial admission visit. And that's important to you as the patient because that means we're getting to you sooner to help get that joint moving, which decreases your pain, decreases swelling, and it decreases your risk for blood clots. And who wouldn't want that after surgery? We also have a therapist on staff that can come to your home before surgery and perform what's called a home safety assessment. Many of you have never used a walker before, and it's going to be your first time after surgery. And you may be surprised that it doesn't fit through the bathroom like you thought it would. And so that therapist can come and make recommendations and suggestions for you to help decrease your falls after surgery and any equipment that may be helpful to help you get around and be safe in the home. For those of you having a hip replacement, we'll come out anywhere from 2 to 3 times a week. And whether you've had a knee or a hip replacement, you'll come home with a surgical bandage that typically gets removed anywhere from 5 to 7 days after surgery. And we'll assist with removing that bandage because for some of you, your skin likes to keep it a little longer than that. We do cover a 50-mile radius from here at the hospital, and we accept most insurances. With traditional Medicare, there is no copay. The only insurance that we don't cover, and there may be a few others, but is Medicaid, but there is outpatient services available. We also check your vitals when we come for your visits, and so that can be really beneficial for those of you with high blood pressure, low blood pressure, atrial fibrillation, because we'll not only be notifying your orthopedic physician, but your primary care doctor as well. We're also going to look over your medications with you, and we'll notify your primary care doctor of any interactions you may have. I know this is a lot of information today. This would be the point that I walk around the class and make sure that everyone's still awake. But we just want to make sure that you're informed, well prepared, and know what to expect before, during, and after surgery. If you have any additional questions, my card should be in the surgical care bag that you've received. Even if you don't go with our company, if you have any questions or concerns, please feel free to reach out to me. I'd be happy to answer any questions that you have, and we're looking forward to seeing you.
Hi, my name's Brooke, and I'm an occupational therapist here at DRH Health. After your joint replacement, occupational therapy will assess your ability to complete daily tasks related to your self-care. You may find that doing simple things like getting yourself dressed, getting on and off the toilet, in and out of the shower or bathtub, or completing your bathing routine can be quite challenging after surgery. Your occupational therapist will be here to provide you with adaptive techniques and equipment to ensure that you can safely and independently complete your self-care when you go home. In addition to assessing your self-care, your occupational therapist will also guide you through the following exercise program to maintain your upper body strength during your recovery. Chair push-up. Start by scooting your hips to the edge of your chair, planting both feet firmly on the floor. Place your hands palms flat on the armrest of your chair. Push down on the armrest and raise your bottom off the chair until your elbows are straight. You will not come to a stand. You just let your bottom hover and then slowly lower your bottom back to your seat. Side arm raise. Keep your hips at the edge of your chair. Keep your arms straight, palms facing in towards your body. Slowly raise your arms up to your sides, away from your body to shoulder height, and then lower back down. Overhead tricep press. Start by straightening both arms up over your head. Slowly lower the weights behind your head, bending at the elbows only. Press the weights back up over your head by straightening your elbows. Bicep curls. Tuck your elbow in at your sides. Curl the weights up by bending your elbows, and then lower the weights slowly by straightening your elbows. Chest press. Start with your hands at your sides at chest level. Push the weights up towards the ceiling until your elbows are straight, and then slowly lower back to chest level. Chest flies. Start with your arms pressing up towards the ceiling, palms facing in toward each other with a slight bend in your elbows. Spread your arms out to your sides as far as tolerated, and then slowly pull your arms back to the starting position.
Welcome again to DRH Health's Joint Replacement Center program. In the following video, we will be reviewing important information about how you can better prepare and recover from your joint replacement surgery. It is important to note that each case involving joint replacement is different, and your preparation and recovery might differ from others going through the same program. This is okay. Let's start with some preoperative activity recommendations. Research indicates that the best predictor of your joint flexibility after surgery is how flexible you are before surgery. Furthermore, we know that muscle size and strength inevitably decrease after a surgery such as joint replacement. For these reasons, we recommend that you do your best to maintain your daily activity levels during day-to-day tasks as your pain allows you to. We also recommend that you begin our preoperative exercises as soon as you know you will be having your joint replaced. These will help your joints and muscles prepare for the surgery to come and make it easier to get started with your speedy recovery right after surgery takes place. Here are the exercises we would like for you to perform while preparing for surgery. Please keep in mind that if any of these exercises cause excessive pain, it would be prudent to reduce your number of repetitions or remove the troublesome exercises from your routine. Likewise, if you have trouble performing them due to balance or safety issues, please refrain from performing any risky maneuvers. Remember that there are a number of people who can benefit from formal physical therapy to help them prepare for surgery. Be sure to ask your surgeon if preoperative physical therapy, also known as prehab, is right for you. Now, onward to the preoperative exercises. Start with ankle pumps. Keep both legs straight. Pull your toes up toward your nose and then point them down. Complete 10 to 20 repetitions. Buttock squeezes. Squeeze your buttock muscles. Hold 5 seconds. Complete 10 to 20 repetitions. Heel slides. Start with legs straight. Slide your foot toward your buttocks. Keep your knee pointed toward the ceiling. Slide your foot back toward the end of your bed or chair and push your knee as straight as you can. Complete 10 to 20 repetitions. Thigh squeezes. Slowly tighten the muscles on the front of your thigh. Straighten your leg as if you are pushing the back of your knee into the bed or chair. Hold 5 seconds. Complete 10 to 20 repetitions. Single leg raise, also known as straight leg raise. Bend your non-involved leg and keep your involved leg straight. Raise your involved leg off of the bed or chair, keeping your knee straight and thigh muscle tight. Do not lift your involved leg higher than your opposite knee. Complete 10 to 20 repetitions. Hip slides. Keep your knees straight and toes pointed toward the ceiling. Slide your leg out to the side and back. Complete 10 to 20 repetitions. Those 6 exercises will help you prepare your muscles and joints for surgery. Please keep in mind that the majority of joint replacement patients go home within 1 day of surgery, so being familiar with these exercises will make the transition home much easier. Next, we will take a few minutes to review your post-operative exercise routine. Feel free to try these exercises before surgery to get familiar, but please remember to avoid any risky maneuvers. The first 6 exercises are the same as your pre-operative routine. To get through the entire post-operative exercise routine, it could take anywhere from 10 to 30 minutes. For the sake of this video, we will be going a bit faster than that. At home, feel free to pause this video as needed. Let's have a look. Start with ankle pumps. Keep both legs straight. Pull your toes up toward your nose and then point them down. Complete 10 to 20 repetitions. Buttock squeezes. Squeeze your buttock muscles. Hold 5 seconds. Complete 10 to 20 repetitions. Heel slides. Start with legs straight. Slide your foot toward your buttocks. Keep your knee pointed toward the ceiling. Slide your foot back toward the end of your bed or chair and push your knee as straight as you can. Complete 10 to 20 repetitions. Thigh squeezes. Slowly tighten the muscles on the front of your thigh. Straighten your leg as if you are pushing the back of your knee into the bed or chair. Hold 5 seconds. Complete 10 to 20 repetitions. Single leg raise, also known as straight leg raise. Bend your non-involved leg and keep your involved leg straight. Raise your involved leg off of the bed or chair, keeping your knee straight and thigh muscle tight. Do not lift your involved leg higher than your opposite knee. Complete 10 to 20 repetitions. Hip slides. Keep your knees straight and toes pointed toward the ceiling. Slide your leg out to the side and back. Complete 10 to 20 repetitions. Seated leg stretch. Place your involved leg straight out on the recliner or on a chair or stool in front of you. Place a strap or belt around your foot. While keeping your involved leg straight, pull your toes toward your head and lean forward at your waist until you can feel a stretch on the back of your leg. Repeat 10 to 20 repetitions. Seated marching. While seated, march in place. Try this while sitting upright without your back supported in the chair. Lift your knee 5 to 8 inches. You can do this with both legs. Seated kicks, also known as long arc quads. Sitting in a chair, slowly kick your involved leg straight while keeping the back of your thigh on the seat. Try to maintain good control of your leg during this exercise. Complete 10 to 20 repetitions. Leg squeeze. Place a ball or pillow between your knees. Gently but firmly squeeze and hold for 5 seconds. Complete 10 to 20 repetitions. Seated knee range of motion. Scoot to the edge of your chair. Pull your involved leg back as far as possible until you feel a stretch, and hold this for 10 seconds. Complete 5 to 10 repetitions. Standing marches. Stand while using your walker for support. Lift your involved leg toward the crossbar of your walker. Complete 10 to 20 repetitions. Standing heel raises. Stand while using a sturdy support. Keeping your knees straight, rise up onto your toes. Complete 10 to 20 repetitions. Standing hip side kicks. Stand while using a sturdy support with your legs shoulder width apart. Slowly kick your involved leg out to the side while maintaining good posture of your trunk. Keep your knee straight and do not let your toe turn outward while kicking. Complete 10 to 20 repetitions. Standing leg curl. Stand while using a sturdy support with your legs shoulder width apart and your toes straight ahead. Bend your involved leg at the knee as far as you can and then return to the starting position. Complete 10 to 20 repetitions. Mini squat. Stand while using a sturdy support with your legs shoulder width apart and your toes straight ahead. Slowly bend your knees while keeping good posture of your trunk and then return to the starting position. Complete 10 to 20 repetitions. Remember that these exercises should be performed in addition to your continued physical therapy. They are not a replacement. During your post-operative recovery, it is important to keep up regular communication with your physical therapist so that your program can be updated and progressed to best suit your individual needs.